Hello everyone, Dr. Berk. We placed the varicocele implant. We performed the varicocele surgery. What will happen next? One of the most frequently asked questions. There's curiosity about outcomes of the varicocele surgery. Really, let me explain it briefly, piece by piece. First of all, the surgery, if I can perform the routine procedure. Early in the morning, I discharge the patients in the afternoon. We host patients coming from afar, from outside the city for one day in the hospital. The next morning, we take it out. Our surgery lasts about half an hour to 45 minutes. It is done under anesthesia. After the surgery, resting for 1 to 2 days is important for us. We generally recommend bed rest. The most questions come in regarding returning to work or returning to sports. On average, you can return to work after a week. Of course, if you do your job sitting down and you're not doing much physical activity, actually you can return after 3 to 5 days. You don't need to wait a week, but if you're doing physical work and there's a heavy load, then we wait for a week. For athletes or those involved in sports, this recovery time to return to sports is about 15 days. How long until I can return to my sex life? On average, we can resume normal sexual intercourse after 15 days. When should we evaluate the sperm? Now, the lifespan of sperm production is about 60 days. It varies between 70 days. Therefore, we get the best results 6 months after the surgery, but we evaluate it 3 months after the surgery. So the sperm evaluation is done for the first time 3 months after the surgery, and then at 6 months. It's done monthly. If we perform this surgery, our pain decreases significantly. Pain is rarely observed post-surgery. It no longer significantly affects our social life. After the surgery, pain is not something that is commonly observed. However, if there is a complication or if the person is in pain, if the pain persists, it can last for 1 to 2 weeks. Even if it wasn't done due to pain, still pain, it can continue for 1 to 2 weeks. I mentioned the condition called hydrocele while explaining the surgery. If rate can reach 30%. Under a microscope, it's 1 to 3%. If done under a microscope, the rate is about 1 to 3% because the lymph vessels of the testicle are damaged, leading to fluid formation around the egg. There is also a swelling. When we look with our hands, we see a swelling. When we touch it, this swelling is usually soft and generally painless. We had filmed a special video about recurrence. It recurs between 1% and 45%. Recurrence is somewhat dependent on how the surgery is performed and the individual's anatomical condition. But generally after the surgery, these are the things we need to do, things we need to pay attention to. Thank you.